Welcome back. At Oklahoma Spine and Orthopedic Institute at Hillcrest, they can diagnose your low back pain and provide the best treatment. Then you can go on and enjoy your life without the pain. And we're happy to welcome Dr. Richard Drake this morning to educate us about low back pain. Thank you for joining us.
Thank you for having me.
And Mike was saying earlier he's had a little low back pain from the baby. He's run away now, but so I told him I'd be taking notes to give him some advice. Well, what are some of the common causes of getting some lower back pain?
The most common cause of low back pain is overuse type of injuries, sprains and strains to the ligaments, the joints and the muscles of the low back. This is the most common cause. The most common will go away on its own with time. Other causes are usually due to the nerves being pinched in the spinal canal, and they can be pinched from disc bulges or disc herniations, arthritis, and the changes that occur with arthritis. Bone spurs can cause pinched nerves. As they get older, patients can have a lot of back pain from stenosis, which is narrowing in the spinal canal from bone spurs and disc bulges. And there's more rare causes of back pain, such as fractures, tumors, and spinal infections are very rare.
Wow, well, those sound very painful. What are some of the treatments that people can go through so that they can alleviate some of that pain?
Most back pain is initially treated with conservative modalities, which would be physical therapy and activity modifications, anti-inflammatory medications. We treat it commonly with core strengthening, aerobic conditioning, and those are kind of the first line treatments. Sometimes we use injections, spinal injections, blocking nerves, and sometimes we do surgery.
Do you see more people coming in around this time of year with back issues, or is it pretty all year round?
It's pretty year-round for back pain, but certainly the stress of the holidays can lead to a little bit of accentuated back pain, and carrying packages and lifting and putting up Christmas trees and Christmas lights certainly may lead to a little bit more back pain.
All right, you said surgery. At what point do you get to the surgery point of treatment?
Surgery for spinal conditions is generally a last resort. Typically, if you have spinal instability where one vertebrae is slipping on the other, or if you have a severe pinched nerve or a weakness from a pinched nerve, these are conditions that we would be more likely to treat with surgery. If you've gone through conservative treatment for several months and you are still have a disability from back pain, then you may be a candidate for surgery as well.
And you guys, if you do get to the point where you need surgery, you have a pretty minimally invasive procedure?
Spinal surgery has changed a lot in the last 10 years. We have much more minimally invasive ways to do a lot of the old-fashioned techniques that we used to do. We use smaller incisions, we use microscopes and small tubes. We can do a lot more with a lot less dissection and destruction of the tissue that we used to have to do to get the job done.
And there are some things you can do as a preventative measure. What are some exercises people can do to make sure that their backs stay strong?
Risk factors for back pain include genetics is a big deal, smoking, obesity. These are all factors to try to prevent back pain. Smoking cessation, weight loss, core strengthening, yoga and Pilates are excellent techniques for core strengthening. But that's mainly it, staying thin and staying strong.
I didn't know smoking affected back pain.
Smoking is a risk factor that most people do not really appreciate. It leads to accelerated disc degeneration, so the shock absorber part of the spine will degenerate much more rapidly with heavy tobacco use.
Wow, very interesting. Thank you for educating us on all this. We appreciate having you on here. You guys can check out the Oklahoma Spine and Orthopedic Institute there at Hillcrest Hospital. That's at 1120 South Utica Avenue. Give them a call at 918-582-6800. That's okspineortho.com. We've got to get Mike in some Pilates or yoga. I think that'd be a good show.